everybody. I'm Georgina. I'm the CEO and founder of Aria Health, a decentralized health data platform. So I'll tell you a little bit about what we're doing and what we've built. So that doesn't work. So I'll start by telling you, I don't know who knows that in 2021, the NHS UK announced that it was going to be sharing 55 million patient records to private businesses. Now, you can imagine that when this was announced, immediately 3 million patients opted out. Privacy lobby groups came out. The whole scheme got put on hold. So there's an obvious problem here that it is, shall we say, unethical. There's a lack of transparency, and there's a clear lack of involvement from the patient side. But this is also having impacts on the industry side. So on pharmaceutical industry, we see that more than 80% of patient data is currently siloed at either inability to sort of interoperate those silos, also getting consent and permission to use that data. We see that there's a lack of access to the patient. So it's not only the data that we need, we actually need access to the patients, and we need those patients to be much more engaged. So over half of clinical trials, they get terminated because they don't have enough participants in them. We see that we have a 40% dropout rate, and one of the main reasons being that patients aren't feeling engaged, they're not feeling involved in the process. So this is what we've looked at. So, you know, we've seen that the current system, yes, it's ignoring patients, it's limiting data access, we don't get engagement from the patient, and as a result, all research is being hindered. So we've created a health data network, which is all about engaging patients, rewarding data sharing, and incentivizing active participation in the healthcare space. So we go to healthcare providers initially. So we're focusing on electronic health records. We go to the healthcare providers and we automate the process of extracting the medical data from their health information systems and bring that into the blockchain ecosystem. We hand back that control to the patient so that they have that control and privacy over their data. And then they can then consent to whether they're happy for that to be used by third parties. And that effectively creates a stream of real-world, pre-consented health data, which can be available, which we make available via our database, via our marketplace, focusing mainly on the pharmaceutical industry at the moment, but that could be for AI companies, for public health, for many different parties that need access to this data. So I'll briefly show you how we do it. So we have a mobile application which patients can download, and they create their account, creating their blockchain wallet. They then can go and connect with healthcare providers which we work with, and all they need to do is put in their ID, they send a request, and this sends a message to the healthcare system. Because we're connected with them, there just needs to be an approval on the side of the hospital information system to make sure it's the right person, and then we create a stream of that data automatically comes in from the hospital information system into our blockchain network, and any new data will come in as and when it's created. We take it all in FHIR or HL7 format. We visualize it a bit more engagingly for the patient. And then we have our marketplace. So patients can then decide if they want to opt into our marketplace. They can decide, I'm happy for my data to be used for public health, but not for AI. I'm happy for it to be used for medical research, but not by insurance companies. So they have some sort of visibility over how their data is being used. And then they can select whether they want that information, whether they want to receive clinical trial invites, survey requests, disease awareness campaigns. So we then have that interaction. That's something I forgot to mention earlier, is that not only do we give access to that real world sort of stream of data, but we then create a bridge between the patient and the pharma company so that they can actually follow up patients to invite them to clinical trials, to send them a disease awareness campaign, to send them whether it's a market research survey or a patient-reported outcomes survey. And so they have that direct access to the patient in an anonymous and compliant way. The next thing we do is that all the revenue that comes into the marketplace, we distribute using smart contracts back to all the stakeholders. So the patients, we create 65% of the money goes into a patient revenue pool, and then we distribute that back to the patients depending on how active they are in the network. The more data they're sharing, the more they're responding to a campaign, the more they're responding to research. So we really try to encourage, positive actions in the ecosystem. 10% goes back to the healthcare providers. We need them obviously to come on board to both integrate with us and also bring it to patients. So we need to give them a reason to bring this on board. And then all the access to that data is then entrapped, so we can see who's accessing it. It doesn't just go into a black hole, but the patients know, right, my data was used for this diabetes trial, and this led to this impact and this outcome. So we really want to educate patients that when you hear, for example, the NHS is sharing your data, that's not necessarily a negative thing. It's actually a positive thing, and it can have a positive impact, and it can be good, but it's all about communication and transparency here. So then on the other side of this, I mentioned we have our marketplace. So this is where our pharmaceutical companies can come. They can do normal inclusion, exclusion criteria to identify the data that they need. And then they can either get access to the data, to data insights, or which is more where I think our niche comes in, is the patient engagement aspect. So you can identify specific patients based on their EHR profile, and then be able to send those requests for clinical trials, those surveys. It's all anonymous, it's all based on consent, it's all compliant, and it's then going to patients who have access to an application which they're already engaged in. They already have their medical data there, they're receiving their rewards there, so it's a place where they feel there's an element of trust, there's an element of control, and so that's where we see the engagement rates being higher and the dropout rates being lower. So a bit in terms of sort of where we are. So we initially launched our app in 2 hospitals in Europe. We had twice the engagement rate compared to other solutions. Our focus at that stage was on the first part, so a patient app, integrating with the systems, overcoming the compliance issues, etc., and creating that health data network. Now we are expanding into 26 hospitals in the UAE. We have access to more than 3.5 million patients, and this is where we're now bringing the marketplace. So we're also working with partners like Novartis and other CROs and pharma companies to get them engaged in our marketplace side of things. So yes, that's a little bit about what we're doing. Thank you. It's a pleasure to be here, and I love this community.